The color and texture of your number two might not be something you'd discuss at the dinner table. However, it's one of the most critical indicators of your overall health. You can laugh about it or just ignore it completely. But here's the truth. Your poop is sending you urgent health warnings that could save your life. What comes out of your body isn't just waste. It's essential data about what's happening inside you. Most people flush without looking, but that could be the biggest mistake you ever make. What you're about to discover will shock you and could literally save your life. The color, shape, and consistency of your stool might not be your favorite conversation topic. In fact, most people would rather talk about absolutely anything else. However, it's an incredibly important topic for your overall health and well-being. You can joke about it, feel embarrassed about it, or just try to shush and ignore it. But keep in mind that poop is an essential and valuable piece of data regarding our health that we absolutely should not ignore or dismiss. Our stool is usually made of undigested food particles, proteins, bacteria, salts, dead cells, and other waste materials our body doesn't need. It can vary dramatically in color, texture, amount, size, shape, and even smell. Not all these changes are worrying or dangerous, but certain occurrences like blood in the stool, black stool, or persistent changes can signal some very serious and potentially life-threatening problems. So let's dive deep and see exactly what our body is desperately trying to tell us through our stool. Before we proceed any further, please note that everything mentioned in this video is completely unbiased, thoroughly fact-checked, and carefully reviewed by qualified health professionals and licensed medical experts. With that important disclaimer said, let's jump right in and talk about 12 critical things your poop reveals about your health. Number 1. Healthy poop. Let's begin with healthy poop and what it should actually look like. Of course, we are all unique human beings with different bodies and diets, so our poop might be just as unique and individual. However, there are a few general characteristics that are common to any healthy stool that everyone should know about. Do you know the poop emoji? Yes, that friendly brown swirl. That's actually the lovely shade of brown our poop should ideally have. It's a result of our stomach bile and the bilirubin pigment that forms naturally after the breakdown of old red blood cells in our body. As for shape, healthy poop should look like a smooth log or a hot dog, not too lumpy, not too broken up. Its regular, consistent shape is given by our intestines as the stool passes through. It should be completely pain-free and pass effortlessly without straining, pushing, or discomfort. The pungent smell is totally expected and normal because the bacteria in your stool naturally emit all sorts of gases during digestion. Don't worry about that. In terms of consistency and texture, a healthy poop should be firm and well-formed, but definitely not rock-hard or painful to pass. It should be soft and smooth, but not ice cream soft or mushy. It should come out as one or two solid pieces, not breaking into too many small fragments. A healthy bowel movement typically means you have your number two once or twice a day. Some people might have their stool every other day, and that's not ideal, but it's still okay and within normal range. However, if more than 3 days pass without having your stool, then you're officially constipated and need to take action. Last but not least, a healthy poop should take you no more than 10 to 15 minutes maximum. You might spend more time in the toilet scrolling through your TikTok, Instagram, or reading, but it shouldn't actually take you more than 15 minutes to get the number two done and complete. If it consistently takes you more than 15 minutes to poop, you have a poor bowel movement and digestive issues. Consider eating more fiber-rich foods, drinking significantly more water throughout the day, and doing more regular physical exercise. Number 2. Constipation. Well, if you have less than 3 bowel movements per week, you're definitely constipated. That's pretty clear and straightforward. However, struggling to go or spending more than 15 minutes trying to do your number 2 can also signal a poor bowel movement and digestive problems. Are you familiar with the Bristol stool chart? It's actually a fun and interactive indicator of the different types of poops people usually produce. It was published back in 1992 based on a comprehensive 2,000-person research study. It's basic and simple, but it makes it incredibly easy to understand and identify poop types. That came out a bit weird, didn't it? Anyways, the first type of poop on the Bristol stool chart is called marble poop or rabbit pellets. It consists of small, hard lumps or pellets that are separate and difficult to pass. This indicates severe constipation and serious digestive issues. The second type of stool that indicates you're mildly to moderately constipated is called the caterpillar or lumpy sausage. It's the long-shaped and lumpy sausage-like stool that's quite hard to pass and causes discomfort. If you still manage to do your number 2 at least 3 times a week, but you always struggle significantly and consistently have these types of stool, you should seriously consider adopting a diet that's rich in whole grains, fresh fruits, and vegetables. You should also see a doctor or qualified nutritionist who can help you develop a good, personalized diet plan. It's not normal, folks. The problem is usually in what you eat and your lifestyle. See a nutritionist or gastroenterologist about that. Don't just suffer in silence. Number 3, lack of fiber. If your stool looks like amoebas or soft blobs with clear-cut edges that are either hard or easy to pass, you might be seriously lacking fiber in your diet. You might notice other warning signs as well, such as constant hunger shortly after meals, incessant food cravings throughout the day, low energy levels and fatigue, problems sleeping well at night, difficulty concentrating, and general digestive discomfort. Consider adding significantly more fruits to your daily diet, such as pears, apples, avocados, raspberries, strawberries, and oranges. Vegetables such as broccoli, Brussels sprouts, carrots, or beets are also extremely high in fiber and very beneficial. Eat more legumes like split peas, chickpeas, black beans, or lentils. Whole grains like oats, quinoa, brown rice, and fiber-rich seeds like almonds, chia seeds, and flax seeds should always be on your shopping list and daily menu. Liking our video so far? Before we move on to the next sign, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative and life-saving videos. Number 4, inflammation. If your stool is fluffy, mushy, and has ragged edges like torn fabric, it can signal inflammation somewhere in your digestive system. When your body is dealing with an offending agent like viruses, harmful bacteria, and other toxic chemicals from the environment or food, it will react in all sorts of ways. We call these reactions inflammation, your body's natural defense mechanism. Other symptoms of inflammation might include persistent abdominal pain, chest pain or discomfort, extreme fatigue, fever or elevated body temperature, joint pain and stiffness, headaches, and general malaise. If you have this type of stool followed by 1 or 2 of these additional symptoms, you should definitely seek medical help and professional evaluation as soon as possible. Number 5, diarrhea. A soft-serve ice cream consistency or a Jackson Pollock splatter-type stool means you've got the runs, diarrhea. Basically, your stool moved way too quickly through your bowels and digestive tract and couldn't form into a healthy, normal type of poop. Diarrhea can have many different causes, from bacterial or viral infections to eating upsetting or contaminated foods, food allergies or sensitivities, certain medications and antibiotics, radiation therapy, chemotherapy, or poor absorption of nutrients in your intestines. In most cases, it's just something you ate that didn't agree with your system. However, if serious symptoms such as dark concentrated urine, rapid heart rate, severe headaches, flushed red skin, confusion or disorientation, extreme dizziness, severe nausea, or violent vomiting follow episodes of diarrhea, you should immediately see a doctor or go to an emergency room. You might be severely dehydrated or have a serious infection that requires urgent medical treatment. Number 6, gastrointestinal bleeding. A black stool resembling coffee grounds or tar might suggest serious gastrointestinal bleeding somewhere in your upper digestive tract. You might be wondering why black is a sign of blood when blood is usually red, right? Well, it took a while for your stool to travel all the way down through your long digestive system, so the blood had time to be digested and could easily turn much darker and black in the meantime. GI bleeding is a serious sign of a digestive tract disorder that requires immediate attention. Other symptoms might include severe abdominal pain, chest pain or tightness, vomiting blood or coffee ground-like material, difficulty breathing, shortness of breath, or severe lightheadedness and fainting. Therefore, you should absolutely not ignore a black stool. Don't just hope it goes away. However, don't get too scared or panicked either, because sometimes what we eat can temporarily influence the color of our poop without any serious problem. For example, if you've recently had black licorice, foods that are rich in iron like red meat or spinach, iron supplements or multivitamins, bismuth medications like Pepto-Bismol, or black stout beer, they might temporarily cause black poop that's completely harmless. But if you notice frequent black stool that persists or keeps returning, definitely go see a doctor immediately for proper evaluation and testing. Better safe than sorry. Number 7. Liver or gallbladder issues. If your stool is white, gray, or clay-colored like pale putty, you might have a serious problem with your liver or gallbladder. Pale poop suggests a significant lack of bile production or bile flow into your intestines. Certain anti-diarrhea medications might be a temporary cause of pale stools. However, pancreas or gallbladder problems, bile duct obstructions, or liver diseases might also be why your stool does not contain enough bile to give it that normal brown color. If you notice pale stool but have absolutely no other symptoms at all, you could wait and see if your poop returns to its lovely normal shade of brown over the next day or two. However, if your children, babies, or toddlers have pale white poop, you should immediately rush them to the hospital or emergency room. In infants, this can indicate serious liver problems or biliary atresia that requires urgent medical intervention. Number 8. Too much bile or not enough bilirubin. In some cases, your poop might come out in various shades of green, from light green to dark forest green. It could be simply because you ate a lot of leafy greens like spinach, kale, arugula, or other green vegetables. But it can also be because of too much bile in your stool or insufficient bilirubin pigment. If you haven't eaten too many green foods recently, your poop might be green because it passed through your digestive system too fast and couldn't pick up enough of the brown coloring from bilirubin pigment. Parasites or harmful bacteria can also cause green poop and rapid transit. Infections like Salmonella, Giardia parasites, or norovirus can make your guts flush much quicker than normal, making your stool look distinctly green. Crohn's disease, ulcerative colitis, or other serious GI conditions might also make bile move through the intestines too quickly, so your poop will come out green instead of brown. Green stools might also be caused by irritable bowel syndrome, IBS, taking too many laxatives or stool softeners or certain antibiotics and medications. Number 9. Hemorrhoids. If you notice small amounts of bright red blood in your stool or on the toilet paper, that might be because of hemorrhoids, swollen veins in your rectum or anus. Eating lots of berries, beets, or drinking too much tomato juice or red-colored foods could also temporarily cause your poop to turn into a shade of red or pink. However, once these foods are completely out of your digestive tract within 24 to 48 hours, your stool should return to its normal healthy brown color. So, consistently seeing bright red blood on the tissue after having your bowel movement is usually a clear sign of hemorrhoids. If you also feel like some skin or tissue is sticking out of your anus after your bowel movements, or you feel a lump or swelling, then you almost surely have a case of hemorrhoids. It's not a cause of panic, emergency, or shame at all. Hemorrhoids are extremely common. Millions of people have them. They're not life-threatening, and they might even go away on their own with lifestyle changes, more fiber, and more water. If they become too uncomfortable, painful, or persistent, you can go see a proctologist or colorectal specialist who can provide treatment options. Number 10. Not absorbing bile properly. If your stool is orange or bright orange like a pumpkin or carrot, it means it's not absorbing enough bile properly because it's moving too quickly through the digestive tract without enough time for proper digestion and bile absorption. This rapid transition and quick movement can be triggered by several different conditions, including irritable bowel syndrome, IBS, short bowel syndrome, SBS, certain digestive disorders, or even chronic diarrhea. Eating large amounts of orange foods like carrots, sweet potatoes, or foods with orange dye can also temporarily cause orange stool. Number 11. Fat absorption issues. If you have yellow stool or pale yellow greasy-looking poop, it means your poop contains way too much fat that isn't being digested and absorbed properly. A fat buildup in the stool can be caused by many different things, including serious issues with bile production, pancreatic enzymes, or digestive enzyme deficiencies. You should probably see a doctor or gastroenterologist and do proper medical tests to investigate this issue. If the test results confirm that you have too much fat in your stool, called steatorrhea, then it means your body cannot absorb the nutrients and fats properly. This is a medical condition called malabsorption syndrome. Malabsorption can point to a serious series of problems with your intestines, pancreas, or liver function. In some cases, the pancreas cannot produce enough digestive enzymes to properly break down the fat you eat. In other cases, the liver cannot produce enough bile to break down these fats for proper digestion and absorption. However, changes in the stool color could also simply be caused by normal variations in diet and the specific foods you eat. If you experience poop color changes that last for more than 2 weeks consistently or have black or red stool often and repeatedly, you should definitely see a doctor for proper evaluation. There's absolutely no need to panic or immediately think of the worst-case scenario. Just go see a specialist or gastroenterologist. It's the best and smartest decision you could make for your health and peace of mind. Number 12. Food intolerances and allergies. Allergies or specific food intolerances can also significantly affect your stool and bowel movements. For example, people with lactose intolerance will probably experience diarrhea, gas, bloating, and cramping if they eat dairy products like milk, cheese, or ice cream. People suffering from celiac disease, an autoimmune condition, might have an adverse and severe reaction to gluten found in wheat, barley, and rye. And that can definitely show up in the stool with diarrhea, greasy stools, or malabsorption symptoms. Conclusion. All in all, our stool can tell us a lot of incredibly important things about your body, digestive system, and overall health. You can also take a sample of your stool to your doctor for laboratory tests to determine if you have any harmful stomach bacteria, parasites, infections, or digestive diseases. So it won't do you any harm at all to check and observe your poop from time to time. In fact, it's actually a very smart health habit. Moreover, you should keep track of how often you do your number 2, how much fiber you're eating daily, how much water you're drinking, and how your overall digestive system is functioning. All these things can have a great and significant effect on your overall health and well-being. Mind your poop, folks. Pay attention to what your body's telling you. Enjoyed this video? Hit the like button right now and subscribe to our channel for more informative and life-saving videos like this one. Thanks for watching. Your wellness is our mission.